Hey everybody, welcome back to Boomx Beauty Beat. I know it's been a long time since I've been on here. Where have I been? Well, I've been in Mexico. I went and had surgery. You guys know that I did a transformation on my body, and what was left was some skin that I had to get removed, and it is not a small feat. So here it is. I'm on my way home. Where's home? New home, new existence, new everything. Just know you always remake your life. Never let other people define you. This is the view outside my window I want to show for you guys. And here's the room, lots of space. I got my Slim Fast shakes ready to go. Chair, 2 beds, one that I've been sleeping in the last couple nights. This one is when you first come from the surgery, and that is towards the outdoors. And look, I'm just getting ready to have my healthy lunch, fish, rice, and beautiful vegetables. Emma's restaurant downstairs, so good. I treated myself to some Sephora makeup. Shut up, yes, I know, bad. But I wanted to try out some new lipstick for my new lips. And then here, you can see there's safe, fridge, closet for hanging your stuff. I didn't hang anything up. And then my bathroom is a mess. There's me, hello. I'm on my last day here, and my lips are still, 2 weeks will be big, but that's the fat from my own lips. I'm not angling very good. And then the walk-in shower is like, this is my hospital stay. It's been great. Okay, I'll take a picture with William, my first and favorite. Well, they're all wonderful nurses, but he called me brave when I first got. He goes, "You by yourself?" I said yes, and he called me brave. I'll never forget that. I started to cry because I was scared. Okay. Hi guys. Okay, so I'm just going to show you. Well, my bathroom is really messy. Hello. And the shower with a little bit of a hospital chair there. I just wanted to show you before I messed up my room some more. There is a safe, fridge, there's garbage, and I got in my room, it's just, I like this painting actually, I really enjoy it. There's 2 beds. There's one when you first have your surgery, you're in here. And then you move to the nicer bed as you get maybe 3-4 days in. And outside here is a beautiful, you can do a view. I have all my bag is a mess. You can do a view here. Pretty soon I'm gonna, wait, I'm not doing, hold on. Okay, a couple more questions. All right, now I'm completed everything. I finished my week. I leave tomorrow. Now is the time to learn about recovering and that process. What should patients expect? I know every surgery is probably different. Like for me, for example, how long before it looks as good as it's going to be, and the process now.
Mm-hmm. Right now, the most difficult time of recovery is the first week. That's why I ask them, the patient, to stay here. But once you are at home, it's very important to keep taking care of the wounds, avoid extreme or exercise after a month. I always suggest to begin from 0, like never done any exercise before, and consider that the final result of any surgery is a year. Don't expect the final result after 2 weeks or a month. You're going to be very swollen. The body takes its time to recover, so it's important to be patient.
Yes, and like walk for a couple months start the gym very slow. But you did couple extra gifts for me. I have very dark under eye circles. Many people know me from my dark under eye circle. And then also, always I had small lips. So one bonus is that I was able to reposition some of the fat from other places. I don't know where you took it from, but under my eyes and in my lips. Now they're swollen right now, so when we take a picture, they look a little bigger. But can you explain that part? I forgot.
Yeah, we take advantage of doing those areas, the arms and the lower back, and we only need maybe 20 cc's or of fat tissue to transfer to the areas you want to improve or increase the volume under the eye and also your lips. So it's something that we must consider. If the patient comes here and do a big surgery, we can give that extra.
It's a special bonus, very big bonus though.
Of course, we tell the patient if we're taking a lot of time from the surgery, I'm not going to do that because it's going to increase the time of the surgery.
It depends.
It depends
if you can do it, but
of course.
And then and with that, there's a little bit of swelling. But why is it better than, say, for example, filler is a big deal everywhere now. Filler, Botox, why is it better maybe to take your own fat?
It's not. Well, your own fat is part of your body.
Yeah.
The first thing, both the fillers can be absorbable, but the part of the fat tissue that absorbs, it's going to make only a little scar. But the one that remains there is going to work as any fat tissue in the body and give volume. And you're not going to reject that fat tissue in the future, or you're not going to lose that volume. So I think it have its advantages from the fillers.
Yeah, I can't thank you so much, Dr. Castillo. This has been the best experience of my life. I'm dreamed of this from being a chubby child and fighting my weight.
It was a pleasure having you here, and I hope that I have all my patients like you.
Oh, gracias. I learned a couple of words, but not much Spanish. And for now, on the phone, people will take my phone from me and put the translation. So if you're worried about that you can't speak the language, you can't drive, all of that it's workable. You can use the phone now for translation and transportation. I was not good with the driving here, okay? Yeah. So I have all that was taken care of by the office, and all of the stays and everything was wonderful. So I just want to thank you. I can't wait to show you the final result when all the swelling goes down, and everyone the results. And I want to take a picture. It's okay?
Of course.
Okay. Gracias.
No, gracias a ti.
Okay. Was I an okay patient, Dr. Castillo? I fainted one time, right? I passed out because I took too strong. What did I do wrong?
It's a normal thing because patients are dehydrated the day after the surgery. They don't eat well or drink too much. So it's very easy for them to that the blood pressure falls down. Yeah. So it's important then when you come here or you ask somebody to take you to the restroom, because if there's nobody there, nobody's going to know that you faint. Fortunately, there was people that keep your body falling down, so it's nothing happens. But it's important to consider that all the patients can faint the first day or first 2 days. And
you did not send me operation and then send me back to my country. I stay for 1 week after, so that I had aftercare. You have beautiful aftercare experience. There's a couple of options. One is a special house, and another one is at the hotel. There's a whole floor of a group of nurses. They became like friends after 1 week. And the food, it's very good. Emma's at the Grand Hotel is Emma's restaurant. Very, very good food. Now, what is the most popular procedures, and what emotionally should people be thinking before considering doing this?
Talking about post-bariatric patients, they always try to remove the biggest amount of volume they have. Some patients has a lot of volume in the abdominal area. Some of them has a lot of hanging skin in their arms. So I tell the patients which area is your first concern, and we go first to that area.
Yeah.
And then we consider, because we can't do everything at once, we try to do it on stages and in different occasions with a separation of 6 months between the procedures.
Yeah. You recommend 6 to 9 months. I know when I went for my other consultation, almost felt like I was being upsold. With you, I feel like, no. I feel like you do it for the good of what's the best for the patient. You do what is going to make them feel the best results, not for the money, only for the money. Because a lot of think like already in the US has become a big money maker. So with you though, it seems more from the heart. Do you agree? This is
I love this profession I choose. Is one of my dreams, and I finally I can do it, and that's why I always thank God for giving me this present of life.
Yes, and for those that are seeing this and they want to learn more or get more information, I will put it down in the description box below. But what do you suggest they think of first when they're considering doing any procedure? What should they think?
They must look for a doctor.
Yes.
But check that the doctor is a plastic surgeon, because there are many doctors that are not even surgeons.
Yes.
A certified plastic surgeon. If it has more certifications, it's an extra, but with a certification from the college of where he is being part, it's enough to know that it's a good doctor. And second, how good you feel with that doctor, talking with him, how he answers the questions, and how confident you feel about the doctor. That are the most important things I think you can consider, because testimonials are are good, but I think it's the most difficult thing to obtain from the patient, because more the video testimonial, it's extremely difficult make the patient talk in front of a camera. But that's why sometimes we don't have that much as we want.
Yes.
But those two things are the most important things. The experience of the doctor, how you feel, the empathy of the doctor, and if you feel confident doing the surgery with him, go to it. Do it.
Okay, so now I'm gonna bug you a little bit about my procedures we decided on getting done. Can you explain what you did to me?
Okay, well, you contact me because you want to get rid of that excess of skin in your arms. So I suggested to do an arm lift.
Yes.
So, but I also looked at because I always ask for the whole body pictures. I saw that when they make you the paniculectomy, they only reach at the hip bone level, but you still have a lot of excess of skin on the hips and the back, the lower back and butt. All that skin fall down, and that needs to be corrected. So I suggested to complete the 360 abdominoplasty and to do the arm lift.
Yeah.
And that will be neck.
And the goal, because also you have to keep in mind this, each surgery takes so much time and you can only concentrate so many hours. So people have to be realistic how much can be done in one time, correct?
Correct, and it's not the same for all the patients. There are more difficult patients. There are patients that are on their ideal weight, and there are patients that haven't reached that weight, and we need to do the surgery in a higher weight, so I cannot combine the same amount of procedures that I've done with you.
Yes.
That's why we need to personalize the procedures.
Now, at 53, was I a good candidate my age? Is this a concern? And was my weight okay to do were you concerned at all with those things?
Of course, yeah. The average of age is between 40s, 50s, or middle 50s of post-bariatric patients, so it's a very common thing. But I always ask not only the age, I ask them to be in a healthy stage, that they don't have any complications of diabetes or hypertension or something like that, or they are very well controlled of those illnesses. So it's important to consider that too, not only the age and the weight. There are too many things that we need to evaluate first.
Did you feel fairly confident I should be pretty okay to do these procedures?
Sure,
Yes.
Sure.
Now we did the procedures. There was a little bit of troubles. Can we tell them about the troubles and why I had some troubles?
More in the arm lift, one of the complications that when we remove the excess of skin in the arm, we must not get a very tight closing, because the arm is going to get swollen, and with that swelling can go to the outside. It goes to the inner part and reduces the amount of blood supply to the forearm.
Yeah.
So that's the most common complication that can happen. Fortunately in you, it's only one arm, and it's not that aggressive that I need to reopen the wound to release that pressure. So we only need to wait that time for you to recover, and that's it.
Yes.
Yeah.
Okay, so Dr. Castillo, I'm always curious, why did you decide to choose this career, and how did it progress for you? Can you tell me a little of your history?
I've been thinking since childhood to be a doctor, but it was until maybe high school when I have a friend of mine that we decided to do this kind of thing. He's an attorney, but I promised to be a doctor, and I love it. I never regret to take this decision. And it's a long journey, but it's worth it.
How did you choose your school, and how long does it take you to go through and learn to do this?
If we consider from elementary school, it takes me around 24 years to finish the whole process of being a plastic surgeon.
Yes.
So it's a long process.
And you have accreditation, a lot of different kind. I saw your murals, your certificate everywhere. Why could you choose other places to do plastic surgery, or do you have to do, because you are from here, that you have to practice here, or could you choose somewhere else?
No. Here in Mexico, the country, there are only 3 places where we can do plastic surgery.
Okay.
In Mexico City, in Monterrey, and in Guadalajara. So I am from Mexico City, so I make all my studies in Mexico City, and then when I finished, I came here, and I've been here living for 20 years.
Yes.
So it's I have a long experience in plastic surgery and post-bariatric patients.
Yeah, and I would like to talk about this a little bit. You mentioned, we talked a little bit during, just after my surgery, that is very common, or just about when going, that many people save for bariatric surgery, but then they don't realize the skin that can be affected afterwards. Now, for me, I did my weight loss, diet, and exercise. I didn't do the surgery. I did it, but either way, you can still correct the skin after, but it has to be something that you budget, correct? Or what are your thoughts on this idea?
All the patient must consider then that the skin don't disappear.
Yes.
If you lose a big amount of weight, that skin is going to get loose and is not going to retract.
Yeah.
So sometimes I tell the patients that the circle of losing weight has not finished until you remove all that excess of skin.
Yes.
That bothers you and don't make your normal activities and reduces your quality of life.
Yeah, and they call it plastic surgery, but really is reconstruction, no? Like you're reconstructing, or how would you talk of it?
I think it's a new branch of plastic surgery, because plastic surgery is very, very extensive. We are talking about congenital problems, we're talking about burn people, we're talking about aesthetics, and now we're talking about post-bariatric patients that we don't used to have before the laparoscopic procedures.
Yeah.
And right now it's been a boom of that kind of procedures, more here in Tijuana. And that's why sometimes most patients that already knows Tijuana comes back to do their post-bariatric procedures.
Okay. Dr. Castillo, I just want to thank you so much for all that you did for me. I just was talking to you, we finished the surgery, how many days? It's been like 7 days? 6 days?
Yeah, I normally ask the patients to stay around 7 days after their surgery,
Yeah.
to let them recover enough to travel back home, because normally the patients comes from far away and it's not good for them to return or go back home the next day from the surgery.
Yes, and now we had a consultation by phone because I was in the US when I did the consultation, and I've already had breast reduction surgery, paniculectomy, I never can say it correctly, and I had those done in Canada, and even when I did them in Canada, you saw some errors, like the scar was jagged, there were some problems. So we're here in Tijuana, and people's thinking in a place like Tijuana is no good, maybe it's not clean, maybe this, maybe that. And my experience has been very opposite to this. Do you find that people think like this, or they're scared to come to another country?
It's the most common thing that happens is they think in Tijuana is like a very, very unhealthy city, but we are maybe the number one around I'm not going to be very showing off, but Tijuana is the first medical tourism cities in the world, because of the how near is from the United States, and also we always try to give our best for the patients.
Yes.
And with good quality and less cost for them.
Yes.
Mm-hmm.
How can you make the cost so much less? Because I've had multiple quotes in the US and in Canada. And why is it less expensive here?
I think the thing that makes the United States and Canada more expensive are the insurance costs. for the doctors, because patients in the United States, it's different because the patients don't come here trying to sue the doctor before they know them. In the United States, they sue the doctor for everything. That makes the insurances goes higher and higher, and the doctor needs to ask more money for the same surgery.
So really, the patients are driving the prices higher.
It's
In
one
some
of the things. The other things is that the cost, the living cost